Hello, everyone. How are you all doing today? This is the Lymphatic System Health Live. It's all about autism and the brain tonight. If you have concerns about young children or even about your age and how you are going to think as you age, we're going to learn a lot of great information. I'm going to take you on a journey tonight, and we're going to show a lot of slides, unfortunately, but I take autism very seriously. Hello, everybody. I'm John Ossipinsky. I've been doing this for about almost 6 years, 5.5 years. I've been educating the people. For 30 years, I worked as a certified lymphedema therapist specializing in the brain. And I can tell you, autism is really not understood. And we're missing a lymph-brain connection. Can you imagine? You have a system in your brain that's meant to clean your brain of cerebrospinal fluid and waste, and we ignore it when it comes to any type of neurologic diseases. And we're going to find out today how important it is to know how to clean your brain with the lymphatic system. So I started really learning from Dr. Upledger. I came out of the New York City Fire Department and I moved to Arizona with Eileen. And I got bored and I started to, go to massage school. After massage school, I learned from three world-renowned doctors: Dr. Upledger, craniosacral therapy. This is a really powerful therapy. It's about opening up the brain and spinal cord, the membranes that surround the brain and spinal cord, to affect the whole body. Then I learned from Dr. Burrell, visceral manipulation. We have to open up the organs. Why do we have to relieve the organs, right? Because when the lymph system can't clean them, they fill with waste, constrict, or they can swell. So then, really, what moved me the most was Dr. Chickley, uh, theory and practice of lymph drainage therapy. You have manual lymph drainage, you have lymph drainage therapy. Dr. Chickley, I really feel his book Silent Waves and his therapy is more of a pioneer, where a lot of the MLD and the therapies that we learned before were more for cancer, and now Dr. Chickley really goes into how every system in your body depends on your lymphatic system. So it's something that every single one of us needs to understand, whether we're trying to help a child or have a healthy pregnancy, or if we want to age and have our memories as we age, so that we can remember our family, right? It's something that we all really have to think of. All right, so I want to thank Janai, Jen, Linda, Olha, and Susan for coming on tonight. It's really important that every single one of us, right? Who doesn't know they have a lymphatic system? We never, even though you've learned about this in school, right? You've learned about the lymphatic system. I remember in the first grade, my daughter learning about it, but it's just something you learn about it through school and then uh, all the way through high school, but we never really think of how we use it. And that's what I've become a master of. If I didn't understand how to maintain my lymphatic system, I would have had major health problems. I had IBS for 30 years. I was starting to have heart palpitations, restless leg syndrome I had for a while. I was nauseous all the time. My hair and my beard and hair were falling out. My hands would cramp all the time. My back would twist. And, I didn't know I was toxic. And I was getting a lot of massages. We own massage therapy clinics, but I was having a lot of stress in my life. I was eating the wrong foods. And once I understood the lymphatic system, that I had to maintain it myself, my life changed. Within 3 weeks, my brain popped, actually opened up. My IBS started to go away. I lost like 70 pounds. It's just amazing when we take care of a system that's meant to clean us, what can happen in your body. If you guys have any other health problems, and I'd love to know where you're joining us from, please put the city and state. We'd love to know, or the country. We have people from all over the world sometimes, and what your specific health issue that you'd like, because I'll talk about anything tonight after I'm done. But if you have a specific health issue besides the brain and autism, let me know, and I will definitely work on that. So again, this is something that I am really passionate about, because early in my career, again, I started my work 1994, I think. I did a lot of work on autism because craniosacral therapy was big in the autism community at that time. So I got to see a lot of autism, young, old, and I can tell you it's something that we can address in the womb, I believe, and we need to address it early on, and we'll see the best results. But it is something that I really care about. Let's go ahead and share my screen. And actually, I'm just gonna shut that off for a minute. I do want to mention, and I don't sell my book anymore. If you can find it online, good luck. But it's called An Undetected Acid Alkaline Imbalance. Warning: acid waste and trapped proteins are damaging your lymphatic system, creating illness and disease, right? And it's everything. It's not just one disease. It's not just a brain. It's every disease that we have to think of. And that was written 20 years ago. So I'm going to show you how what I published then, that acid waste is damaging our lymphatic system, creating disease, has come true. Even though in the last 10 years, everything I published has really been verified. Now NIH understands it, and other research is coming out that really verifies that acid is stopping our lymphatic system, really creating most of our diseases. And unfortunately, nobody knows about it. All right, now we can go ahead and share my screen. So I honestly feel that if we understood this information, that we would have a lot less disease. I mean, a lot less disease. We'd have anxiety, depression, cancer. We would have really across the board, we would have less disease because most disease has been linked to this system cleaning your cells. Can it clean around your underarms? If it can't, your arms may have problems. Your hands may get arthritis. If your neck gets very tight, this is where the major lymph vessels, you'll see a picture of it in a little while. When we slouch a lot, we stop these. It starts building up waste in your body, in your heart, in your breast, in your digestive system, in your hips, your pelvis. So this system has to flow, and it's really not doing it. So you really have to realize that you have to maintain your and your child's lymphatic system if you want to have a healthier life. So please check if you have a child who's not, again, who's having some difficulty, check with your healthcare practitioner. And if you have any health problems, please check before doing anything that I say with your healthcare practitioner. So the lymphatic system is your body's sewage treatment system. It's like having a whole house vacuum system. It has to remove water. We see what happens with lymphedema. People swell in their legs. If you have fatty cysts, fatty tumors, if you have fatty liver, right? It's about your lymphatic system not being able to clear that fat, what we call chyle, when it gets into the lymph system. But it's really about proteins that create like log jams in your circulation and limit flow through your body. And that's where disease begins. If your lymph system can't pick up out of your tissues toxins, bacteria, viruses, even cancer, then you're going to have more illness. So it's a system that has to flow. If your lymph system isn't flowing, it's not cleaning. So I was diplomat certified in craniosacral therapy. I understand a lymph-brain connection. I was also, after becoming certified in craniosacral therapy, I became a certified lymphedema therapist to work with, again, decongestive therapy. In 2015, lymphatic vessels were found in the brain. Before that, they always said, don't think of the lymph system for any mental illness because there's no lymph vessels in the brain. Well, now we know that's not true. And now in 2017, the major outflow of cerebrospinal fluid was found to be into lymphatic vessels in your deep neck, right? And if we get tight in our shoulders, and who isn't tight, any of you not tight in your shoulders occasionally, then we're going to limit flow out of our brain. And that's why our Lymphman shoulder shuffle that I'm going to show you later is really so powerful. But your brain is dependent on good circulation of your lymphatic system. So anxiety, depression, panic disorders, really it's everything. PANDAS, Tourette's, Asperger's, autism, normal pressure hydrocephalus. When this area here swells with fluid, it puts pressure on your brain and you end up staying in bed for years and years and years, losing your ability to think and your function. So again, to me, it's all about whether your lymphatic system, whether it's in a child, in the womb, or infant or older, is the lymphatic system cleaning. Now, this is big because 20 years ago, I wrote a book how acid in the body is damaging the lymphatic system, creating most disease. This was just published in April of 2024. Brain acidity linked with multiple neurological disorders. Anybody guess how many neurological disorders there are? Over 900 of them. So it's not just autism, it's not just Alzheimer's, it's headaches, migraines, seizures. It's really a whole list. but they've been linked to acid. In a global research effort, is not a small study. Scientists have uncovered, it's like 130 the different facilities and scientists have uncovered a relationship between metabolism problems in the brain and a range of neuropsychiatric, neurodegenerative disorders from autism to Alzheimer's disease, as well as depression, epilepsy, schizophrenia, intellectual disability, and bipolar disorder. All involve a degree of cognitive impairment. Animal models representing depression induced by stress, diabetes, or colitis, all of which lead to a higher risk of depression. And you'll see how most diseases are really due to senescent cells, which is waste in your body. So as we have diabetes, it's showing you have more waste. Colitis shows you have more waste, and that will lead to more depression, which is, again, shows up because it'll make waste in your body. All of which lead to a higher risk of depression, displayed a consistent pattern of decreased brain pH, which is more acid in the brain, and increased lactate levels, meaning it couldn't clean lactate, which is a byproduct in the brain. Sometimes it's even necessary, but we don't want it to overbuild. So do you know we spend $2 billion a year on antacids? You don't have to have any symptoms of acidity for it to be damaging a part of your body that you don't know, whether it's your brain, whether it's your kidneys, or your heart, or your lungs. So again, understanding that we are acidic. We spend $2 billion a year. You just don't have symptoms of it for most people, but it's damaging your body. And if you're pregnant, it's going to be damaging your child. The emerging importance of lymphatics in health and disease. This isn't me saying the lymphatic system is important. This is the National Institutes of Health. They actually went out and they asked all their researchers, where do we have to look at the lymphatic system and disease? What are we missing? And really, the conference they had was just going to be on lymphedema and weight loss and a little bit of other diseases with the lymphatic system. But what came out was eye-opening, right? What they found, number one, in this report was changes in normal lymphatic function can alter multiple systems in the body and manifest as different and varied pathologies. A pathology is a disease, and there are many conditions related to lymphatic dysfunction within all body systems. So no matter where you have lymphatic dysfunction, your brain, your digestive system, your skin is where you're going to have some health problems. So they really list everything. And I was really blown away when they mentioned the central nervous system, even though they mentioned Alzheimer's, the dementia, aging, hydrocephalus, which is fluid in the brain. They didn't mention autism, so it's not on their mind. But I can tell you heart disease, urologic diseases, every cancer, even blood cancer, skin problems, hair follicle problems, eczema, stem cell maintenance, right? If you're losing your hair even, eye problems, autoimmune diseases, lung diseases, and the pulmonary, any GI problems, right? Obesity, diabetes, and then osteoarthritis and psoriatic arthritis, fibromyalgia. And this is just a small list. Eventually, we're going to know in 20 or 30 years that most disease was due to lymphatic dysfunction. This is a big find because NIH doesn't just say, oh, they research things, but this was a very big study. So we know now that disease begins with lymphatic dysfunction. It's the reason why we want to do the Lymph Man shoulder shuffle 2 or 3 times a day to get your lymphatic system going. But in pregnancy, we never think of the lymphatic system in pregnancy. You have one little vessel on either side of your neck. And if you're the mom's vessels become congested because you're more acidic in your body, maybe you're protein filled, you're not moving enough, or you're eating the wrong diet or taking some medications, then your lymphatic system is not going to function as well, and that's going to affect your baby because you're going to get a little toxic, acidic, and that constricts your lymph vessels, right? That's what acidity does in the body. It constricts your lymph vessels, blood vessels, and your whole that's why you feel tight when we're a little bit acidic. That's the tightness you feel in your shoulder. So to help the baby, we've got to get the lymph system going in the mom. So proper lymphatic system development, this is key. If you know anybody who's going to have a baby, know that flow means go for proper lymph system development. Findings in mice hint at new approaches for treating lymphedema, other chronic lymphatic disorders. And now we know every disease is a lymphatic disorder. This is from 2015. The lymph system provides a slow flow of fluid from tissues into the blood. It returns fluid and proteins that leak from blood vessels, provides passage for immune cells from the tissues to the blood, and hosts key niches for immune cells. How this system develops hasn't been well understood, but now researchers have found from that the early flow of lymph fluid is a critical factor in the development of mature, meaning flow, right? Flow is important. You have to move if you're pregnant. If you're not moving, you're not deep breathing, right? And not just, my mom was a waitress. She said, John, I'm moving all day long, but that's stressful moving. You're moving from one table to another, going to pick up food. You're standing there for a few minutes. You need continuous exercise to get acid waste out of your body. A lot of the work that we do, where we're running around doing things, creates more acid in our body. So once the primary lymph vessels are in place, an enormous amount of maturation, right? It has to mature, has to happen. And what we found is that the maturation process is triggered by physical forces from the earliest flow of lymph fluid in a developing embryo. Is the mom moving? Is she stretching? Is she deep breathing? Is she making flow in her baby, right? So it really has a lot to do with movement. But we never knew that before, that the baby in the womb, its lymph system, how it develops. And maybe my mom, at that time, the women in the 50s, they would have coffee clutches. They would sit around and have coffee. The men would go to work. The women would have coffee and cigarettes while they were pregnant. All right. And we lived through it. But what would happen if we weren't like that? And when I was younger, I studied. I had to go to school. That I vibrate my head. I was a shy kid. You know, I believe I had little problems, and I believe most children nowadays really have that borderline, right? They can be brilliant, or they can have a really bad problem with cognition. So stress is very important. If you have stress, what does stress do? Stress makes us acidic in our body. And we know that acid is related to the brain health, right? So high levels of maternal stress during pregnancy linked to children's behavior problems. Pregnancy, a critical time for mental health care and support. Children whose mothers are highly stressed, anxious, or depressed during pregnancy may be at a higher risk for mental health and behavior issues during their childhood and teen years. Did you notice a rise in anxiety? Actually, the Centers for Disease Control came out and put out an alert. Hey, we're seeing a lot of anxiety in children. Maybe this is why. Not just the stress. I'm talking about everything I'm talking about here. That when we have stress, when we do things like vaccinations, we'll talk about all these things. We eat an American diet. We don't do exercise, right? We maybe drink too much coffee while we're pregnant. These things will actually interfere with how your lymphatic system functions. The research has found that women who reported more anxiety, depression, or stress while pregnant were more likely to have children with more ADHD symptoms, or who exhibited more difficulties with aggressive or hostile behavior, as reported by parents or teachers. Fetal brain impacted. This is big because I know a lot of women may have had a virus, a flu, the cold during their pregnancy. Fetal brain impacted when mom fights severe flu. All right. So even though they saw it in severe flu, I can guarantee you having a flu or some type of a cold, which is a virus, makes excess cellular waste in your body. It can sort of add up over time to build in the body and the brain. New research using live mouse adapted influenza virus improves upon previous mouse experiments to explain how maternal infection impacts fetal brain development. The study also indicates fetal brain changes are more likely once the severity of the mother's infection meets, a specific, it gets much worse, right? Researchers tracked how the infection progressed in the lungs and intestines of the mother, as well as how products from the mother's immune response interacted with the fetal brain. They also measured the physical properties of fetal brains, including the thickness of the cortex, which has been linked to neurodevelopmental disorders in humans. The team tracked immune cells in the fetal brain. Microglia, which are important, that's what cleans up your brain, which infiltrate the brain and interact with developing neurons, had signatures of increased inflammatory activity in fetuses from high-dose flu-infected mothers. So again, if you had a flu, and understand, even if you had, who knows, I won't even bring it up, but if you had any type of cold, flu, RSV, it will actually create cellular waste. Though those viruses take over your cells and make cellular waste. So we have to, and those will again bring in more microglia, which actually become too much, and they become waste, right? Even though they're meant to help the microglia, it's how they clean up. When we have an excess amount of them, we don't have, again, we have more excess waste, which is creating more problems, limiting circulation and how the brain functions. New research identifies key cellular mechanism driving Alzheimer's. I bring this up because some of you may be thinking about Alzheimer's, but I'm talking about microglia here. This is really key. We just understood how microglia can affect, again, in the mom or the baby in the womb during influenza. New research identifies key cellular mechanism driving Alzheimer's disease. Researchers have unveiled a critical mechanism that links cellular stress in the brain to the progression of Alzheimer's disease. Autism is cellular stress in the brain. The study highlights microglia, the brain's primary immune cells, as central players in both the protective and harmful responses associated with the disease. So again, we're learning about again how it cleans up the brain. Using electron microscopy, the researchers identified an accumulation of dark microglia. It's like the bad side, right? A subset of microglia associated with cellular stress and neurodegeneration. There we go, cellular stress in postmortem brain tissues from Alzheimer's patients. These cells were present at twice the level seen in healthy age individuals. Again, in autism, they're going through stress. They're also having problems with their microglia, and they're having, I guarantee you, these dark microglia, which are creating waste, limiting how the brain functions. Do infants need vaccinations? I'll tell you, I'm not against vaccinations. I'm not one of these people that, oh, you're horrible. Because when we had our kids and we went to the doctors, remember, number one, I was dealing with a lot of kids with autism, right? That was what I was dealing with then. So my kids did not get vaccinations. The doctors, the hospital, they treated us like we were killers, right? And I'm glad we did, because both my children would have had major problems if we would have had vaccinations, right? They already had little problems, but they had major problems later. So to me, if you're going to have vaccinations, delay them a little bit, because you're going to see the schedule that you get just for the first few months. But it's really about, you can delay them. Doctors don't like it because it makes more work for them. But you can delay them. Say, listen, I'm going to hold off. Let's do like one or two, one at a time, because these kids are getting a lot of vaccinations. And it's up to you to make sure you clean your child up. Take it into an Epsom salt bath, right? You go in an Epsom salt bath, not hot, not too hot, 2 cups of Epsom salt, and you hold the baby in there for maybe 2 or 3 minutes, 5 minutes. That's it, no more, because it'll make them have a detox reaction. Just a few minutes to open them up a little bit. That's it. Make sure the baby's hydrated, right? All these things. Are you taking magnesium so that your breast milk is going to be better for the baby? One thing I want to talk about very quickly, if you have a baby who has digestive issues, especially the infants, I've had this happen a few times, talking to mothers who I just happened to meet in the street, and their baby's going to go be scoped at 10 months old or around that time because of digestive issues. And I happen to mention acid. Have you checked your pH? Are you acidic? And they said no. Well, I had them come to my office. I checked their pH. They were both highly acidic, which most people are. So we spend $2 billion a year on antacids. And one woman told me, my breast milk, I just check it once in a while, it tastes sour. So a lot of our babies are starting, because nobody knows we're acidic, with soured breast milk. So that's why it's so important to know that you're not acidic when you're having a baby. Number one, it's going to hurt the baby in the womb, that acidity, not allow it to clean as well. But then later, it's also going to help it, right? It's not going to have the good flow to do detoxification in the brain and the body. All right, so this is the vaccination schedule. I just did up to 6 months old, because if you go to 15 months, you'll go crazy. And after seeing many autistic parents and talking to them, parents of children with autism, they basically almost all said that my child was fine. And then about anywhere from a year to 15 months, they got a vaccination. A few weeks later, they were just gone. They were no longer there. And we've had that happen to people close in our family, our friends. So to me, if you want to do vaccinations, number one, make sure your child is hydrated and prepared, and do it a little slower. There's no need to rush into doing how many, by the time they have in the first 2 months, 1, 2, 3, 4, 5, 6 vaccinations. You think that's good for a baby? That overwhelms their immune system. It's making an immune response, which is making more cellular waste. Sorry, I get passionate about this, because most people don't understand this, and it's hurting children, especially doctors. So there are different stages of, what we have to look at, but it's really the repeated inflammation from vaccinations, right? They get a vaccination, they get a few vaccinations each month, and that creates little rashes in their body. I've seen it often. But inside, it's also making inflammation. So that creates excess cellular waste called senescent cells, which infants in the womb are making senescent cells because it's part of aging, and this is cellular waste. So even in the womb, babies are making waste that's going to clog their body, can damage their pancreas or their brain or their skin. So there are three stages that I consider after working with so many children with autism. Birth to 6 to 8, you're working hard, right? That's when parents are working the hardest to try and help their child. After 8, it gets a lot harder. Like the brain is more plastic, neuroplasticity when they're, under 8 years old or around that age. I'm not trying to cut it off at 8, but even 6 is better. Stage 2, 8 to 16, it gets harder to try and help them, right? Because the neuroplasticity is not there. But it can be done at least. And I'm not always talking about cure. I'm talking about taking somebody who's stimming a lot, who's very antisocial, to see them just avail lift to where they're a little more social, right? They're just feeling better. They're not stimming as much. They have less inflammation in their body. That's what stage 2 becomes. But it could also help them have a better life. But stage 3 is really you're doing maintenance now. You have to keep them where the issues are working. Their skin is not red and inflamed. I've seen kids that have such severe red inflamed skin. Acne, right? So it depends. It all depends on the different ages. So it's about flow in the brain. These are veins in the brain, but we have a lymph system in the brain that has to flow. And a lot of it's going to flow down the back of the head or a little bit into the sinuses in the front of the head. But when we're having a lot of vaccinations, when the mom is acidic in her body, the brain is not going to flow as well. That's why we have so many neurological diseases and why so much anxiety. Autism linked to increased cerebral spinal fluid, right? This was from 2017. Most people never heard about it. MRIs show a brain anomaly in nearly 70% of babies at high risk of developing the condition who go on to be diagnosed, laying the groundwork for a predictive aid for pediatricians. Sorry. All right. Been all worked up about this today. A national research network found that many toddlers diagnosed with autism at 2 years of age had a substantially greater amount of extra axial cerebrospinal fluid at 6 and 12 months of age before diagnosis is possible. They also found that the more CSF cerebrospinal fluid at age 6 months old, as measured through MRIs, the more severe autism symptoms were at 2 years of age. The lymphatic system must remove cerebrospinal fluid from the brain. It's not doing it in infants. We can't yet say for certain, remember this is 2017, now we can say for certain that improper CSF flow causes autism, but extra axial CSF is an early marker, a sign that CSF is not filtering and draining as it should. This is important because improper CSF flow may have downstream effects on the developing brain. It could play a role in the emergence of autism symptoms. I have no doubt it is. Autism and ATP. ATP is energy. Why so many people don't have energy, right? Adenose triphosphate, I believe it is. Metabolism of autism reveals developmental origins. Researchers have shed new light on the changes in metabolism that occur between birth and the presentation of autism spectrum disorder later in childhood. The researchers discovered that a small number of biochemical pathways are responsible for the majority of these changes, which could help inform new early detection and prevention strategies. There's a little bit to read, but I want to get it across. Of the 50 different biochemical pathways the researchers investigated, just 14 were responsible for 80% of the metabolic impact of autism. The pathways that were most changed are related to the cell danger response, right? When the cells are under stress, you get a cell danger response, a natural and universal cellular reaction to injury or metabolic stress. When we have acid in our brain, it's metabolic stress. The cell danger response is primarily regulated by adenose triphosphate, ATP, the body's chemical energy currency. While these ATP signaling pathways do not develop normally in autism, they may be partially restorable. That's key. They may be partially restorable through pharmaceutical drugs, of course, that's what they say. But I believe by changing a child's diet, I know even young infants, mom has to change her diet, right? Because if she's breastfeeding, she has to give those nutrients to the baby. But it's really to understand that if we don't have ATP in our body, we can't really, again, function. But the reason we don't have ATP is because of acid. It's well known that when our blood cells, red blood cells, they're acidic, they can't hold oxygen. And then you can't make energy, and that's our fatigue, but it's also damaging the brain. Even cancer has to do with oxygen in the body, they're finding out. So acid in the body, we limit oxygen, and oxygen is needed by your cells. So if this system can't clean you, and that was your deep lymphatic system, this is your superficial lymphatic system. If it can't clean you, you're going to get all kind of problems, right? You're going to see, sorry, you're going to see a buildup of zombie cells in your body. And zombie cells, you see them on your blood tests. You know, they're showing you have more waste in your body or cells that might be bigger or bad, and they're basically just not able to clean themselves. And the mitochondria is actually the cellular powerhouse of the cell, and it can't sort of function in toxicity. And if the environment around your cell is toxic, and that's what your lymphatic system must clean the environment around your cell, then your cells are going to get toxic. And senescent cells, they don't clean up. They fill with heavy metals. They fill with fat, and they give off a component that damages the cells around them and kills them and makes more of an immune response, which is going to be more cellular waste. So we want to get good at removing these cellular senescence from dysfunction of mitochondria, accumulation of metals, disrupting of autophagy, how the cells are cleaned up in your body, lipid droplets to release of senescence-associated secretory phenotypes, and chronic inflammation. So senescent cells are chronic inflammation, and they've been really established to be really every disease is by this waste building in your body. Anxiety linked, right? A big part of autism, anxiety. Obese mice lose anxiety when zombie cells exit their brain. Researchers have shown in mice that obesity increases the level of zombie or senescent cells in the brain. You don't have to be obese to have anxiety, right? You could still have senescent cells as these cells just building in your body. They're not viable. They're not replicating anymore. They're meant to replicate, and they're not anymore. They're just not being taken up by the body into cells, and that those cells in turn are linked to anxiety. When senolytic drugs, they use quercetin and a chemo agent, which we don't want to use, are used to clear those cells, the anxious behaviors in the mice dissipate. They went away. Clearing the cells with senolytic drugs in the 2 mouse models resulted in anxious behavior ending, lipid cells in the brain disappearing, and neurogenesis. This is important, or normal neurological cell growth resuming. So when our brain is acidic, it's not actually growing neurons, and that's important, which I'm going to show you in a minute. So when people lose their ability to think, again, it's about cognitive loss is senescent cells building in their brain, these zombie cells. Zombie cells are the ones that can't die but are equally unable to perform the functions of a normal cell. These zombie or senescent cells are implicated in a number of age-related diseases. Trust me, it's not even age-related, all diseases. When senescent cells were removed, we found that diseased animals retained the ability to form memories, eliminated signs of inflammation, and did not develop neurofibrillary tangles about Alzheimer's, and had maintained normal brain mass, right? It's really about, again, getting rid of this waste. But it's not just the brain in autism. When I have seen children, their skin sometimes were like on fire, and it changes quickly. But look at acne. A lot of them have acne on their skin or on their face. It's the lymph system not being able to clean, but it's not just acne, and it's not oily sebaceous glands. It's just inflammation. And they give kids who have acne these horrible drugs that dry them out, that gives them more depression later, right? Because it's drying them out. And we need fluid in our body. We need cholesterol. We need fats in our body. So I teach everybody a Lymphman shoulder shuffle. Keep this picture in your sight that we have a little vessel. That's your lymph vessel, that little white one on either side of your body. This side on the left side handles 3/4 of your body, everything in the lower body and your whole left side. The right side is just dependent on a vessel here. So if these vessels clog up, you can have intestinal problems, you can have, again, hemorrhoids, you can have hip problems, you can have skin problems. It's everything. And if these black up, the brain can't flow. So I had IBS for 30 years. It went away about a few weeks after maintaining my lymphatic system, right? And it's something I have to maintain. But if you have SIBO, if you've been told you have leaky gut, doesn't it make sense that we get bacteria or leaky gut because we have a system that's meant to clean us and it's not doing it? We clogged up here, and then we have 3 vessels down here that have to clean the whole body, and they clog up because it's 3 vessels going into 1. So that's why we have to move when you're pregnant. If you're not moving when you're pregnant, then your baby is really just getting filled with its own waste, and you need to move to get your lymph system moving to help clear that waste. Lymphatic vessels help repair intestines, and this is really about every health damage. Every health problem can be repaired this way by helping the stem cells. Insight into how the intestine repairs damaged tissue. Investigators have identified a component in the intestine that plays a critical role in repairing damaged tissue. Scientists found that endothelial cells in the lymphatic vessels produce molecules that are essential for the maintenance and regulation of stem cells and tissues in the intestine. So if your lymph system can't clean your intestines, then it can't make healthy stem cells. It can't make that molecule, and it can't clean that waste. That makes inflammation. And that's why I had IBS for 30 years, because I couldn't get healthy stem cells to heal my intestines. Plus, I was eating the wrong foods, right? I wasn't maintaining my lymphatic system. It went away quickly. People who learn my information, their health changes quickly within a few weeks. And I'm not talking about curing autism or curing cancer. I'm talking about quality of life, right? But many people have arm problems, head problems. They feel better the next day. This is one I just found today. I found a lot of research today. I put this together. Aberrant induction of mediated cellular senescence contributes to neurodevelopmental defects. We use embryonic mice and human organoids to model key features of VPA drug exposure, including exencephaly, microcephaly, and spinal defects. In the mouth, so they malformed the tissue, right? In malformed the tissues in which neurogenesis, remember we learned neurodegenesis and the anxiety when they removed the waste, the neurogenesis happened again, right? So here we're seeing that in the malformed the tissues in which neurogenesis is defective, meaning the cells, the neurons aren't able to replenish as well, we find pronounced induction of cellular senescence in the neuroepithelial cells. Critically, through a genetic and functional studies, we identified as the P19ARF as the instrumental mediator of senescence and microcephaly. Together, these findings demonstrate that misregulated senescence in NE cells can contribute to developmental defects. How do we clean up the cells in the brain? We improve the lymphatic system. We get rid of waste in the brain, in the body, in the mom and the baby, right? We're talking both ways here. If you already have a child, it's the same thing, right? That's one thing nice about my work. We help every health problem the same way. We get rid of cellular waste, we balance the body, and then we move the lymph system. I just learned this today too. Cortical myelination in toddlers and preschoolers with autism spectrum disorder. We typically talk about myelin in MS, right? In multiple sclerosis. And that's the fatty padding around your neurons. Our finding of aberrant age-related trajectories of estimated intracortical myelin content in young children with ASD relative to TD. That's just children who don't have any type of autism, suggests that this fundamental neurodevelopment process is altered in the first years of life in autism, meaning in the first years of life, the myelin is already degrading. This is something that we don't talk about. And in MS, we know that when the myelin again gets depleted, it's not sending the messages. They start having more and more problems. So again, this little fatty cover and it's supposed to be continuous, is your myelin, and it gets degraded. Now, if it gets degraded, then the nerves can't send the messages. They're slowed or don't do it. So this is what it's supposed to look like, very healthy. And this is what it looks like in MS. And they're saying that the same thing happens in the first few years of autism. What would degrade this? Acid in the brain, acid in the neurons. Again, this is my own theory. You won't find much about this anywhere else. If you do, please let me know. But I believe this is really right on target. This is what's happening. Diet trumps meds. So it has a lot to do with our diet. If you're still eating a lot of white flour, a lot of, foods that a standard American diet, a lot of meat, sugar, diet trumps meds for anti-aging and good metabolic health. A study comparing the impact of diet versus drugs on the inner workings of our cells has found nutrition has a much stronger impact. Conducted in mice, the research showed nutrition, including overall calories and macronutrient balance, had a greater impact on aging and metabolic health than 3 drugs commonly used to treat diabetes and slow down aging. So if we have children who are having health problems, or if you're a mom who's pregnant, taking and eating, if you have gestational diabetes, they'll put you on a medication, but changing your diet is going to make the biggest change. And remember, all diseases are metabolic diseases, how your body is functioning. And it comes down to your lymphatic system. Anxiety effectively treated with exercise. I put that in here because why is anxiety working? Because it creates pressure. Exercise works to create pressure into the brain to, again, get rid of that waste. Both moderate and strenuous exercise alleviates symptoms of anxiety even when the disorder is chronic. A warm-up was followed by circle training around 12 stations for 45 minutes, and sessions ended with a cool down and stretching 3 days a week. There was a significant intensity trend for improvement. That is, the more intensely they exercise, the more their anxiety symptoms improve. Meaning you just can't go out for a nice leisurely walk and do some stretching. It'll help. It'll make a difference. But if you want to get waste pushed out of your brain, out of the baby's body, you have to do a little movement. And if it's a child who's, again, has been diagnosed with autism, you have to take steps to get their lymph system flowing, hydrating them. It's very hard to change their diet. That's where supplements will take place, but also learning how to drain them. That's what I teach people, right? We need to learn how to drain ourselves, but in my course, I teach how to do a little bit on a child, because parents would always say, John, okay, I know how to drain myself now. How do I help my child, right? So I put a lesson in on that. But it's really important to understand that everything, we need to get blood pushing through the body. That's why we have to move, especially if you're pregnant or if you have a young child, you need to get them doing some exercise. I would have my kids run and chase me around a park, or we go out on a bicycle ride, right? You got to find out what your child can do. But when they're younger, it's really about getting some work done and getting their lymphatic system going manually, getting to learn how to deep breathe, watch their posture, right? If kids are sitting over on their phones and laptops bent over, they're stopping their lymphatic system. Benefits of resistant exercise training and treatment of anxiety and depression. Depression is also a thing of autism. A new study has demonstrated the impact resistant exercise training can have in the treatment of anxiety and depressive symptoms. There is exciting the evidence, particularly from our previous and ongoing research of the available studies, that suggests that resistance exercise training may be an accessible alternative therapy to improve anxiety and depression. Why? Because it's pushing into the body to remove waste, right? These senescent cells, and to get rid of acid. If we don't move, then we're not getting rid of that acid waste. And this is key. This is the most important thing. And even though I'm talking about heart disease here, I believe your kidney disease, heart disease, your brain issues, or everything could be helped by changing the microenvironment around the cells. So targeting the microenvironment rather than a specific cell type could be the key to healing injured hearts. A groundbreaking scientific study has unveiled a remarkable discovery that may have far-reaching implications for the treatment of heart disease. I believe every disease. The implications are immense, offering glimpses of a future where heart disease may no longer be an irreversible condition, but a challenge that can be overcome through medical intervention. The potential for developing novel therapies that leverage the body's innate regenerative capacity holds great promise for millions of individuals with heart disease. But I believe if we understand how to get our own innate healing capacity working instead of depending on drugs, then we can do a lot better, and we can help our children too. Our study challenges the existing paradigm, suggesting that targeting the microenvironment rather than a specific cell type is instrumental in healing the injured heart. So rather than giving the heart cells, some medication, what it needs, change the environment around your heart. For your children, change the environment around their brain, and that's the cerebrospinal fluid. And we do that by getting the lymphatic system going and getting the body to be in balance, not being acidic. So how do we restore the brain's trash disposal system? It is from 2024. Scientists have restored the brain's waste clearing process in aging mice, offering potential new treatment for Alzheimer's, Parkinson's. Again, it's not just aging. Our children are being affected by lymphatic systems that aren't functioning because they're acidic. So it can happen in the young. Same thing can happen as we age. We just call it the different things. This research shows that restoring cervical lymph vessel function can substantially rescue the slower removal of waste from the brain associated with age. If you have a child, if you're pregnant, you need to know how to drain the head and neck so that you can keep the brain flowing. It's great to go see a therapist once in a while, but it's what you do on a daily basis for your child. Understanding diet, understanding how to clear the brain, right? How to use your own two hands with some very simple things to have your child perform detoxification in the brain and the body, because the body is also dependent on coming here. So, right, everything in the body has to come up to these vessels. So when we help the lymph vessels here in the neck, we're going to help the body and the brain. And doing the lymph man shoulder shuffle really opens those areas. That's why it's such an important thing to do. But this is key, right? We can take charge of it. We're almost done. Targeting the cellular senescence in metabolic disease. Remember, every disease comes down to be how your body metabolizes, how it gets rid of waste. Cellular senescence, right? Cells no longer viable, not replicating, can be pro-inflammatory. And inflammation, we know, is the root cause of disease. In aging and obesity, senescent cells accumulate in many tissues, including adipose tissue, brain, kidney, pancreas, and liver. These senescent cells and their downstream effects appear to perpetuate inflammation and have been implicated in the pathogenesis of metabolic dysfunction. Increasing immune clearance of senescent cells holds significant promise for treating metabolic dysfunction in multiple tissues and disease states. Autism, not just the brain, it's the skin, it's the lungs sometimes, it's the digestive system, right? Sometimes it's cancer as they get older. So by taking care of this one system, really, it helps everything. It gives you a chance of having a better chance of lowering your risk of further disease. So we are in a new era, and I'm sorry about my passion, but I'm surprised I didn't break down and cry a little. But the new era of the lymphatic system, no longer secondary to the blood vascular system, because I'm so passionate about helping children. They know that the blood system, they know all about it, but they didn't really research the lymphatic system. Years ago, they couldn't really see it. It's really hardly seen in the body. The largest vessel in the body could hardly be seen. Most of them are microscopic. But now in the last 10 years, a lot has come out. And in the next 10 to 20, 30 years, we're going to hear a lot more. Again, NIH has found that disease begins with lymphatic dysfunction. And this is from 2012. We hope to convince readers that the lymphatic system is no less essential than the blood circulatory system for human health and well-being. Yet we never think of this in pregnancy. We never think about it in curing a disease, helping a child, or in living a life and having a brain and having a vibrant, healthy brain as you age, right? I want to be 115, but I'm not perfect in my lifestyle. I'm not one of these people who I eat vegetables all the time, and I like to enjoy myself, but I basically maintain myself. I know how to clean up, and that's what most people have to do. All right. Thank you for putting up with my passion. Did any of that make sense? Any of that make sense to you? Whether you're trying to help a child with autism or trying to help yourself with any disease, we're filling with senescent cells, and we have to learn how to get rid of these senescent cells. And I have been doing this in children and adults, a lot of children I have helped, really around the world. And I'll explain how I do the distance lymphatic healing. I'm a medical intuitive in a minute. I miss talking about that. And I might as well talk about it right now. Well, let me talk about some things that you should be doing. We want to understand what you need to do, right? If you want to help a child, it's all about how can you improve their lymph flow, right? Very simple. How can you improve the lymph flow? And one thing, if you have a young baby, a toddler, do not swaddle them too tightly. I have seen people, swaddle that baby really tight. And just think about it. Now, you just squeezed in the baby's shoulders and neck. How can that baby breathe? Try and breathe when you squeeze your arms in. Take a deep breath. It's difficult. Babies will be like that for hours sometime. And it's limiting how they perform detoxification and why maybe so many people, children have lung problems, but it's also limiting flow out of their brain. Don't get me started. I get passionate about this. I think of more and more things. It all comes down to waste in the body. All right. So thank you, Jen, joining from North Idaho. Stagnant lymph in the whole body. All right. It'll affect your whole body, right? You'll have whole body pain. And if anybody has any questions, you can put it into the Q&A. This is from OHA. Is there a lab test for senescent cells? I don't believe there is, but you can check C-reactive protein. That also shows, it's one specific protein, C-reactive protein, that also shows a lot of inflammation. And Janai, she's from northern Minnesota. Lymph node on the side of her neck, been there since the end of 2024. That is not too long. So you may be able to work on that. There are things you do. Went to doctor, did blood tests, ultrasound. They couldn't find anything. Went on a raw food diet. Long story short, I went to biological dentist and had the mercury removed from 6 teeth. My lymph neck is still swollen. I do the big 6 daily. And again, I really don't know the big 6. I know a lot of the other therapists talk about that. I really don't. But to me, it's not just about drainage. And it's not just about eating vegetables, right? A lot of people come up with a vegan diet. It's more about taking steps to learn how to clean up, and that's what I become a master of. So, sometimes it pays to do a distance lymphatic healing session with me. I'm a medical intuitive. I've been doing this for 20 years. I worked in an office for 26 years, but I've worked on an intuitive for 20 years. And my sessions, people feel it. I mean, I'll be putting out a few things in the next few days. I mean, people say, my God, I feel so different from one session. We have a lymphatic system that's clogged in our body. And whether you had an infection, whether you had a fall, trauma, stress in your life, dehydration, meds, we don't know what stopped it, but it'll just stop one vessel. And I have an ability to open it up through your body, and it changes your life. And I've worked on a lot of autism with children, and parents will tell me, oh, the next day the child, didn't sleep well at night. They had a little bit of, their urine became smelly. They had a little bit loose bowel, uh, it cleans them out, and we have to learn how to clean up. So again, it's really about how is your body cleaning, and it doesn't matter what health problem, especially if you've got a disease like Lyme. We talked about it last week. So if you missed last week's Lyme, make sure if you can go into Facebook into our group, Lymphatic System Health Mastery. We did a whole thing online. And quercetin is again that's what they use in the Mayo Clinic studies. You can definitely use it daily. There are many supplements that you can use. The biggest thing that most people have to take is magnesium. So what should you be eating? More cruciferous vegetables. Stop the white flour for a while. Lay off maybe beef. Have a little bit of fish, right? Because fish is omega-3s. It's good for your brain, right? If your child can't take fish, is a little older, a little younger, then get some fish oils, right? And put it in their food. They have flavored the lemon type. So we have to start giving our children things to nourish their bodies, especially if they have any health problems, to get their healing capabilities, their natural healing capabilities working, because they're not. And it's not because we're acidic, it constricts the lymphatic system, and then we don't clean. So I hope that's clear. That's really important. And to have healthy children, you have to have a healthy flowing body. And here's a tip for you if you're pregnant or if you want to watch your children, posture. If you slouch a little bit because you're pregnant and it's pulling on you, it's just going to pull tighter. Where if you stand up straighter and stretch every once in a while, you're going to keep those tissues around the baby and into your hips and into your ribs a little looser. But if you just stay slouched all the time, they're going to tighten up and make it harder for your baby to move. So a little bit of gentle stretching backwards, a little bit of twisting to the side could really make a big difference if you're pregnant. Hydration is very important if you're pregnant. All right. Anybody have any other questions? So you really just have to take steps to get the lymph system going before things get worse. Because if we ignore the lymph system, if we ignore acidity in the body, we just get more and more inflamed, and it starts affecting the other things in the body. And we don't want that to happen. And that's why we have to really maintain our lymphatic system, to our body sewage treatment system. All right, I'm going to show you two things tonight. I'm going to show you how to do the Lymph-Man shoulder shuffle. I'm going to put some information up, but I want to explain a little bit about my sessions, what I do in my sessions. When I work on a child, I don't work on the child. Meaning I work on a child, but I work through the parent. I once worked on a child with autism. The grandfather was driving him around in a car because he don't relax well. He was driving around, and the two grandmothers were in and listening to me. And I worked on a child, right? And they heard me. The child had some benefit, they noticed, and they both felt a benefit to it. So anybody who hears me can get a benefit. But I actually just see the child as if it's in front of me. I see I'm holding the child's clavicles, I'm opening up its abdomen, I'm draining its underarms. Oh, I'm draining around the heart, I'm opening up the baby's eyes. I actually do a full session like I did in my office called Lymphatic. And we start very light, because most people are very toxic, especially if you're on the spectrum. And we start with a very light session. Excuse me. Whenever I start doing the Lymph-Man shoulder shuffle, I do a few times, I start burping, get my system going. But whenever I work on a child the first time, I tend to work on the parent mostly, so they can understand what the child may feel, and then I'll work on a child maybe 15 minutes. But I do a lot of explaining. During my sessions, I just don't do a session. I coach you on supplements. I coach you on a few things, one or two things, two or three things to do to help the lymph system. I'm not going to show a whole drainage routine. Those are my courses. I have a $97 course that we're in now, and an 8-week course, and we're starting that at the end of March, most probably. But my the distance lymphatic healing sessions are powerful. They really are. People who have had immobility in their arm for years after having cancer surgery, you know, it would start moving the next day. Their pain would go away. So again, most people need a few sessions, but activating the lymphatic system, changing your diet, and taking a few recommended supplements like magnesium will really make a great difference in how we heal, whether it's a child or an adult. So I really believe it's everything. All right. So, okay, let's do the Lymphman shoulder shuffle. So you're going to put one shoulder up to your shoulder, one shoulder down. If you're older, you have any pain, you have any shoulder problems, you have neck surgeries, do it very light. And wait a day. Do it about 10, 15 times. Wait a day and see how you feel the next day. Because it may make you have more pain. Now, if you don't have any pain, do it a little faster. Just pump it up. My shoulders are creaking, cracking. Oh man, I want to take a deep breath. And if you're pregnant, you're doing this 2 or 3 times a day, you're going to continually be opening up your lymph system. We don't think about it, but you have, my nose is tingly, so I know it's helping my brain. I feel movement in my back. I feel movement in my pelvis, my abdomen, my legs. So as you open up your lymph system, you're going to help your baby's lymph system. So remember, Lymphman shoulder shuffle 2 or 3 times a day. Just do it gently and make sure you're hydrated. And one other thing, I'm going to show you the deep cervical lymph vessels. We need to open these up. So again, your vein, your arteries are right here. We're not going to go near them. We're going to put our fingers right underneath your ears. Put your finger pads right underneath your ears up towards the top. And we're just going to stretch down and release. Stretch down and release. It's a gentle stretch. Stretch down. And I feel that all the way up into my head. And I feel it in my feet. I feel circulation. As we move one area of the body, we move the rest of the body. So Lymphman shoulder shuffle. And then just hold the neck very gently and just stretch it down. Do it 5 to 10 times. See how you feel. All right. Some people may even get a little TMJ because it's going to pull waste out of your TMJ muscles and make it feel irritated. Because waste is really trapped in our tissues and our organs and our brain. And as it comes out, it just doesn't come out. It makes it a little toxic at first. And that's what you want to work with somebody who has, I have 30 years of experience, over 30 years now, working with the lymphatic system to help detox the body and brain. And I can tell you, go on TikTok and just look at Lymphman. Look at all the people who say, just my Lymphman shoulder shuffle. Thousands of people say, wow, this is helping me. I'm feeling great. And they're just doing the Lymphman shoulder shuffle. Imagine what it would be like to really understand this system and how it can help your child. All right, everybody, I appreciate you showing up. If anybody's part of a group of parents with autism, please, I'm going to put this up onto YouTube. Check out my YouTube. I'm going to have this up later on today. All right, everybody, I appreciate it. If you have any questions, contact me at healthylymphsystem.com. That's healthylymphsystem.com. Have a great day.